So let's today discuss about 10 myths about cancer and cancer treatments. Hi everyone, welcome back to the channel. Today we are tackling a topic that is close to my heart: cancer myths and misconceptions. Did you know that outdated beliefs and biases can actually impact how cancer patients are treated and even how they see themselves? Let's break them down, some of the most common myths and why it is time to leave them behind. Myth number 1. The death sentence myth. Let's start with the biggest one. The idea that a cancer diagnosis is a death sentence. While cancer is serious, medical advancements have come a long way. Early detection, targeted therapies, and immunotherapy have dramatically improved survival rates. Many cancers are now curable, and even advanced stage cancers can often be managed effectively and sometimes curable. A diagnosis doesn't mean giving up. It means fighting with better tools than ever before. Myth number 2, the biopsy myth. Here is a myth that needs to go. The idea that a biopsy can spread cancer doesn't. Biopsies are essential for accurate diagnosis and treatment planning. Avoiding a biopsy due to fear can delay life-saving treatments. Trust the science on this one. Myth number 3, that chemo is always bad. Some people avoid chemotherapy because they have heard of a bad experience. But cancer treatment is highly personalized. Side effects are real, but they're also manageable with today's medical advancements. Newer options like immunotherapy and targeted treatments often have fewer side effects. So don't let someone else's experience dictate your decisions. Every cancer journey is unique. What worked or did not work for someone else does not mean it will be the same for you. Myth number 4. Age and cancer treatment. Age is just a number. What really matters is your overall health and functional status. Many older patients tolerate and respond to treatment well and see significant benefits. Don't let a number hold you back. Myth number 5. Stage 4 cancer equals hopeless. With new treatments, many stage 4 cancers are managed like chronic illness, just like diabetes or kidney disease. Patients can live for years with a good quality of life. Some stage 4 cancers are even curable, for example, testicular cancer or melanoma. Let us start treating patients as if their time is already up. Hope is never off the table. Myth number 6. Few months of survival is not worth it. Here's a tough one. The idea that a few months of survival is not worth it. But who gets to decide what is worth? For some, those extra months mean time with loved ones, achieving personal goals, or simply enjoying life. It's not up to anyone else to judge. It's about what matters to the patient. Myth number 7. Hospitalized cancer patients are too sick for treatment. Hospitalized cancer patients who are otherwise managing well with their outpatient treatments may sometimes be admitted due to infections such as pneumonia or sepsis. In the hospital, they can appear severely ill, leading caregivers and medical teams to mistakenly assume their overall condition is declining. This can result in premature discussions about limiting treatment. But here is a key point. Acute illness like infections are often reversible. Treating them effectively can restore the patient's strength and allow them to continue cancer therapy. Before making any major decisions, always consult the patient's oncologist. Recovery is possible. Myth number 8. Sugar feeds cancer. You have probably heard this one. Cut out sugar and you will starve the cancer. But that's not how it works. While a healthy diet with low added sugar is good for your overall health, it is important to know that all cells, including healthy ones, need glucose to function. Our body maintains its glucose levels in the normal range even if we do not eat any sugar. Even if you are on a keto diet, there is no solid evidence that avoiding sugar alone will stop cancer. Myth number 9. If you feel fine, you don't have cancer. This is one of the most dangerous myths. Some cancers, such as colon or pancreatic cancer, don't show symptoms until they are advanced. That is why screenings like mammograms and endoscopies are life-saving, even if you feel perfectly fine. Myth number 10. Alternative therapies can cure cancer. Be careful with this one. Some alternative treatments can help with symptoms, but there is no scientific proof that herbal remedies, detoxes, or special diets can cure cancer. Before you accept these treatments, ask for any published clinical trials or any scientific studies done to prove its efficacy. Let's challenge these biases, support cancer patients, and spread facts, not fear. Did any of these myths surprise you? Share your thoughts in the comments and don't forget to like and subscribe for more science-based health insights.